From what I've heard, it's just pandemonium, so do what you can. But I feel like I can offer something in both nursing and respiratory to at least try to help the situation.
Because I told her I want to go to the epicenter. Like, I'm ready to go to the thick of it. Let's do it.
Nurses from Nebraska talking about heading to New York as hospitals in the city continue to remain filled. Healthcare professionals from across the country, they are flying in all to help out. Now, even though there is a glimmer of good news, which we discussed at the top of the show, staff is still being spread thin, and so are the supplies. And now more and more doctors, they're speaking out to tell their stories. Take a listen to this ER physician from the Bronx.
New York City is on fire. Our neighbors are dying. Healthcare workers are being affected. Right now, my boss, my second in command, my nephew, senior nurse, second senior nurse.
The people you just mentioned have all fallen ill from COVID-19?
Yes, and some of them are quite sick.
Let's bring in our guest. He has been very helpful throughout this entire pandemic here for giving us a reality on the ground. Dr. Cioe-Pena, he's an emergency room physician from Northwell Health System. He's also the systems director of global health. Doctor, it's always good talking to you. Let's first give the state of affairs, because obviously we shared with our audience Governor Cuomo's press conference, and while the curve or maybe the plateau is there, you guys are still running at max capacity, right? I mean, things have, at least you've seen the apex of it, but it still ain't pretty.
No, absolutely not. You're absolutely right. What we're seeing now on the ground is a leveling off of admissions equaling discharges. But remember that we've leveled off at a place where basically every hospital in New York State is essentially only a coronavirus hospital. I mean, that's pretty much, between 90 and 95% of the patients we're taking care of have coronavirus. So to say that things are returning to normal, I think, is an overstatement of the truth. It hasn't reached the catastrophic kind of overwhelming of the health system that we all feared this past week. We've leveled off, but we've still got a lot of work ahead of us.
In terms of both the equipment and also supplies, more than just, and I'd love to hear your answer in terms of PPP throughout your hospital network, if all the frontline physicians and the RNs have what they need, but more than that, how much longer can you keep this up? Because I've spoken to other frontline doctors and nurses too, and the emotional as well as the physical exhaustion. You're going now on a month almost. At what point do you get to the point where you just can't keep it up anymore?
Yeah, I think that's a really good question. And we don't really know the answer quite yet. The big concern, I think, is, this is asking a lot of the front end staff, the providers. It's asking a lot of our families. And certainly, it is a marathon and not a sprint. So I think we need to start acting like that. Certainly, we have taken some precautions to try and make sure that we're backfilling people. We're giving people kind of furlough days or days where they're not working as much to try and make sure that we maintain kind of readiness for this long haul. But, in terms of PPE, I feel very well protected. I think psychologically, this last week has been the hardest week that we've had so far, where we've had a lot of colleagues that have been affected by this. Pretty much everyone that I know firsthand has someone that has been impacted or has died from coronavirus. And I think, the emotional toll that takes on healthcare workers is real. And we need to make sure that we're practicing some good self-care in between our shifts and not trying to kind of sprint through this. Because again, this is something that is, thank God, it's leveling off, but it's not going away anytime soon.
Earlier this hour, Doctor, I spoke to both a member of Congress as also a former Undersecretary of Homeland Security about this idea that the president in America wants to go back to normalcy, open up the doors. But can you articulate for people from being a frontline physician, if we go back too soon and there is another spike that has been the norm with pandemics in the past, it's potentially going to be even worse than what you've had to go through and this country's had to go through in the month of March and now into April. How concerned are you that the medicine and the science of this isn't taking precedence over maybe the politics?
Yeah, I think one of the concerns, without delving too deeply into politics, because I'm way out of scope and out of my expertise here, The concern is that if you go back to kind of normal business too early, you haven't gained anything permanent yet with the social distancing. So the social distancing has slowed the virus down. It's made it harder to transmit. But remember, the majority of us aren't immune to this yet. And the majority of us are still susceptible. What we've done is diminish the ability of the virus to move between people efficiently, which is what it's been doing. But we really haven't moved the needle much on how to prevent infections or to quickly isolate cases. We're not at the level of transmission where it's low enough that we could kind of isolate people individually and do contact tracing. It's still widespread. And so the relaxation of social distancing at this point, you are going to see another spike. It's not a if, it's a when. And you'll see more deaths from coronavirus that may overwhelm the healthcare system. And that's a real big concern because it almost takes all the gains that we've made in March and early April and kind of made them ineffective if we stop now.
I think the general public, doctor, has gotten their arms around that this idea that a vaccine is not going to come with a snap of the fingers. It's going to be a year, and that's on the optimistic timeline before we'll have something like that. But in terms of treatment, people, hear about, the president talking about this miracle drug. We're getting cautions from a lot of different parts of the world to say that it's dangerous depending on the dosage levels, and it's also dangerous if not administered properly. And even when administered correctly, it's not this panacea. From your end, where are you? Because I also know Northwell is involved in some clinical trials in terms of treatment, not vaccine, but drugs that can help mitigate some of the conditions people are walking into your ERs with in ICUs.
Yeah, so at Northwell, we have probably, I think, 5 or 6 at last count clinical trials underway that are directly looking at treatment for coronavirus and COVID-19. We're looking at treatment for prophylaxis of healthcare workers. We're looking at treatment for mild and moderate disease to moderate severe disease. We're looking at all different types of drugs. And there really is no clear answer yet. And we hope that with the number of patients that we're enrolling, which has been substantial because the New York area has been hit so hard, we are going to have answers soon. We'll have answers to the clinical questions about whether drugs are effective much sooner than we'll have vaccine answer. But it's still, the jury's out on this, and we're not sure which drugs are appropriate in which setting. And we may have multiple answers where if you have mild to moderate disease, but you're at risk for progression, there's one drug that you can take. And then when you're already in severe disease, there may be a different scheme of drugs. The good news is that because we got trials set up, the people that are presenting that are sick to our hospitals, in which there are many, we've been able to offer clinical trials. We've been able to enroll I think we've enrolled the most number of patients in a lot of these studies that are multi-center than any other health system. And we're trying to get these answers as quickly as possible so that we can bring treatment to bear on the appropriate patients. But we want to use the right drug in the right patient at the right time. And that's complicated medicine.
Finally, doctor, people may not realize this, but hospitals like yours, you're doing just COVID around the clock in many cases, and hospitals are losing millions of dollars by the day. So 2 things. When people say, when am I ever going to get that hip replaced or whatever the case may be, in answering that, isn't testing a huge component to all of this? That if we don't know who's either had it or who hasn't and who's vulnerable, how do you folks ever say, okay, we can open up this wing or we can treat these people, or we don't know when, finally the volume of these patients is really going to turn for the good? Could you articulate better than me why testing isn't just some political debate, but it's a practical one too?
Yeah, no, it's absolutely true. And, one of the things that I'm currently at a state facility at South Beach Psych, and we're trying to stand this up as a COVID-only hospital to try and offset some of the other Staten Island hospitals from the burden of coronavirus that they've had, so that earlier rather than later, these hospitals can become the full service hospitals that they were prior to coronavirus. And you're right now, all we're doing is coronavirus. So, if you do need a hip replaced, if you need any kind of semi-elective surgery, even emergencies, there's no burn unit right now on Staten Island because the burn unit at Staten Island is a coronavirus unit right now. It's a coronavirus ICU. So getting these services back and up and running is important for 2 reasons. We need to offload those patients to some place that can deal with the coronavirus patients, treat them well, treat them fully, but also allow those services to open back up, and then start accepting back coronavirus negative patients that have other healthcare needs and address those needs. And testing is a key component of that, both testing for immunity, antibody testing, as well as testing for the virus itself. And both of those kind of go lock and key with standing up the other parts of the health system again, getting back to some sort of business as usual.
Wouldn't that be nice? Hey, doctor, I know you have gone far too long and your colleagues without just any kind of normalcy, including just regular sleep here. So hopefully sooner than later, that'll come your way because it's obviously well-deserved. Dr. Pena, thanks as always.
Thank you.
All right, everyone, when we come back, what he knew and when he knew it. A national security expert will join us for a look at what the president did and didn't do as his intelligence apparatus was sending out warnings about the virus.